Dyspnea or shortness of breath is actually whenever a patient feels breathless on normal things or on exertion. So if there is any restriction in his activity because of breathlessness, or if he has to catch his breath, he has to stop while running or walking or even talking, that is breathlessness. It's a very, very distressful symptom, and that is because of the feeling that there is more of air hunger. The patient, his lungs or his heart or his blood is not able to fulfill his oxygen demand, and that is the situation of breathlessness. Dyspnea can be at rest, dyspnea can be because of exertion, or dyspnea can be psychological cause. So these are functional causes, or psychological causes we will not be talking about because those are related to anxiety or panic disorders. But when you talk about the organic causes of dyspnea, either it is cardiac origin or pulmonary origin, and pulmonary origin dyspnea can be at rest or it can be at exertion. Most often the pulmonary patients or lung patients will have dyspnea on exertion. So we have a grading system for dyspnea. For the layman point of view, we have a MMRC grading for dyspnea, dyspnea grade 1, 2, 3, 4, and that depends. If the patient feels breathless while heavy exertion, then you grade it as grade 1. If the dyspnea is even with the mild exertion, it is grade 2. So increasingly, if the patient feels breathless, even at rest or even in lying down in the bed, then it is dyspnea grade 4, when patient cannot complete even a sentence without stopping in between to take a breath. Dyspnea or breathlessness is a typical symptom, and most often the patients in pulmonology OPD come with either cough or chest pain or breathlessness, or if they have got a fever with chest infection. So breathlessness per se is a symptom. Now there can be multiple reasons for this particular symptom. That can be because of disease of the lungs. The breathlessness can be because of disease of the heart, or breathlessness can be because of the blood abnormalities or less hemoglobin, that is anemia. 90% of patients of breathlessness will fall in these three categories. Beyond the lungs, the heart disease can cause breathlessness. So any heart related disease, it can be heart failure, it can be heart attack, it can be valvular heart disease, it can be rheumatic heart disease. All these conditions can cause breathlessness, or a patient of acute viral pneumonia causing viral myocarditis can also experience breathlessness. So multiple various diseases of heart can cause breathlessness. Then deficiency of hemoglobin or anemia can cause breathlessness. Even young patients who are appearing for some serious exam or some serious interviews might face breathlessness because of their anxiety disorder. Then acute onset breathlessness, especially felt while exertion or walking or during exercise, can be exercise-induced asthma, it can be pulmonary embolism, or it can be acute coronary event or cardiac MI. First and foremost thing for any patients who reaches to your OPD with a complaint of breathlessness is to find out that patient is falling in which of the organ dysfunction, whether it is heart related dyspnea or it is lung related dyspnea or it is something else. And at times it becomes very, very difficult for a clinician to judge what disease is actually involving it, because at the severity or at the advanced stage of it, if a patient has a chronic or advanced lung disease, the heart will definitely be involved. If a patient has advanced or chronic heart disease, the lungs will be definitely be involved. So in situations like advanced cases, it will be difficult to differentiate both of them. Initial cases, definitely by simple history, their symptoms, their presentation, and after that, X-ray, ECG, echocardiography will define that what is the disease which is causing dyspnea or respiratory failure or breathlessness in a particular patient. Any patient who has got any disease in the lung, heart, or anemia can develop breathlessness. Now, if you talk about only and only pulmonology, the breathlessness or dyspnea can be because of asthma, because of COPD, it can be because of acute onset pneumonias, it can be lung fibrosis or ILD. So otherwise, there are few reasons outside the lungs, like collection of fluid in the pleural cavity, which is called pleural effusion. So these are common lung conditions which cause dyspnea or breathlessness in a patient. Breathlessness should not be ignored at all. At times, a patient feels breathless, and within 2 hours of it, he might require ventilator support. A patient who is hale and hearty, who is young, who doesn't have any past history of any other disease, if he is feeling chest pain or dyspnea or this breathlessness should not be ignored. Secondly, just like thermometer we use at home for checking the temperature, if any patient is feeling breathless, should check his oxygen levels. If the oxygen levels are even 3-4% down from the normal reading of 98 or 99%, immediately contact your doctor. A heart attack patient might feel dyspneic, and within 1 hour, this can be life-threatening. Within few minutes, it can be life-threatening. So if you feel acute onset chest pain with breathlessness, immediately contact your doctor. If you are feeling breathless on walk, and that particular symptom is persisting for 2 days, 3 days, or worsening, immediately contact your doctor. Never ignore respiratory symptoms for long duration. Otherwise, it will be irreversible damage, and it will be very difficult for your doctors to even control that particular condition. Dyspnea per se is not a disease. Dyspnea is a symptom. There are multiple different diseases which cause dyspnea. So you need to understand that whatever is the cause, the outcome and the treatment will depend on the exact actual disease which is causing dyspnea. So if a patient has bronchial asthma, the allergic exposure will precipitate or worsen the condition. And if the patient takes his bronchodilators or inhalers on time, definitely the dyspnea will be improving. So dyspnea is not per se a disease, it's a symptom. So if you define what is causing dyspnea, like in patients of pulmonary artery hypertension, we have to find out what are the causes of pulmonary hypertension or PAH, or what are the causes of dyspnea, and accordingly you will treat. If a patient has hemoglobin of 6, we know that dyspnea is because of low hemoglobin level. The blood has low oxygen carrying capacity. So if you replace the blood, if you transfuse the blood to this patient, his dyspnea will improve. On the contrary, if a patient has COPD, the treatment will be totally different. In a case who has dyspnea or breathlessness because of cardiac conditions, definitely the cardiac medicines or cardiac procedures will be required to improve his dyspnea. So dyspnea is not a single disease, it's a heterogeneous disease which can originate from lungs, can originate from heart, or it can originate from other causes. It's a very, very generic question, because if a patient has asthma, we will definitely treat this patient with nebulization or inhalers. If a patient has COPD, definitely inhaler or nebulization will be part of it. If the patient has got pneumonia, then the mainstay of treatment will be antibiotics. If that is the bacterial pneumonia, or if it is a viral pneumonia, then you treat it with viral diseases, viral drugs, antivirals. So depends on the cause of it. If a patient has got pulmonary fibrosis, or if a patient has ILD, advanced ILD, then definitely the treatment will be antifibrotics, steroids, oxygen supplementation if the oxygen is going down. And if the patient has cardiac involvement or sleep apnea, definitely the treatment will totally be changed. For a patient who has breathlessness because of sleep apnea and fluid overload, he will be prescribed a CPAP therapy. He has to use that during the sleeping time, during the night hours. Same way, if a patient has cardiac origin asthma or cardiac origin dyspnea, definitely the treatment will be from the cardiologist. Dyspnea can completely be cured, and that only depends on the cause of it. So if there is an acute cause, there is a reversible disease, definitely dyspnea can improve. Say a patient met with a road traffic accident and got a blunt chest trauma and his lung ruptured. So you gave him the intercostal drainage, you put a tube, the lung expands in few days time, and it comes to its normal position. You remove the tube and patient will be completely cured of his disease. The same way, if a patient has dyspnea because of pneumonia and you are able to treat that pneumonia effectively, definitely as the pneumonia resolves, patient's symptoms will completely be gone, his dyspnea will be recovered. So it will depend on the cause or the actual disease which is causing dyspnea. If it is a reversible disease, the patient will be cured. If it is a treatable disease, the dyspnea will improve, and it will only trouble in the acute exacerbations or periodic abnormalities. So cause of the dyspnea will determine whether it can be cured or it can be treated or it will be progressive.